Hi, my name is Victoria and I'm the student nurse practitioner going to be assessing to you today, Gary. Gary, what would you like to be addressed by?
Gary's fine.
Okay, and what is your date of birth?
12/29/94.
And then Gary, what brings you in today?
You got some pain going on in my hands.
Okay, and then real quick before I continue, we did get his vital signs and they were all normal. So, Gary, how long ago has this started?
About 4 months or so.
And then where in your hands is it located?
Kind of from the wrist, kind of going up to my fingers there.
Okay, is it on this side or this side that you have it more? On the inside or outside of your hand?
I'd say more on the inside there.
Okay, and then where kind of does it travel? Kind of to these fingers mostly? Is that what you're pointing?
Yeah.
Just checking. Okay.
Yep.
And then when you do get pain, how long does it last?
It kind of depends on if I'm doing anything, but usually like an hour or so if I'm using them a little bit more longer.
Okay. And then do you get it more at daytime or nighttime?
Nighttime.
And then what makes the pain better?
Sometimes I'll take Tylenol or something to kind of try and relieve some of it.
Tylenol? Okay.
Yeah.
And then what makes the pain worse? Anything else that makes it worse? Doing
Just
anything?
mostly if I'm working with my hands or typing or anything like that kind of deal.
Okay. And then let's see. And then how would you rate your pain from 0 to 10, 10 being the worst?
I'd say probably anywhere from a 5 to an 8, kind of depending on.
Kind of what you're doing?
Mm-hmm.
Okay, so what I'm gonna do is I'm gonna assess your hands. I'm gonna ask you a couple more other questions. Do you have any allergies to anything?
No.
And then do you take any medications except the Tylenol?
Just Tylenol.
Okay. And how much Tylenol, do you know the dosage of the Tylenol that you take and how much of it you take?
2 to the 500 milligrams.
2, 5, okay. And then how often do you take that?
It's probably once in the afternoon, once before bed kind of deal.
Okay, so twice a day then?
Yeah.
Okay. And then, do you smoke or chew?
No.
Do you drink any alcohol?
A couple glasses a week there.
Of couple glasses of
Whiskey.
whiskey, okay.
Yep.
And then do you do any drugs?
No.
Okay. And then do you have any pets that live at home?
Just dog.
Okay. And then in the neighborhood that you live is it a safe neighborhood?
Mm-hmm.
Okay. And then for your medical history, do you have any medical concerns, any problems that we need to be aware of?
Not that I know of.
Okay. And then what about for your family? Does your family have any health history issues?
Not that I'm aware of.
Perfect. And then any surgeries that you might have had?
Just my wisdom teeth there back in 2018.
2018? Okay. And then, let's see. I'm going to go ahead and assess you here. So I'm going to just look at your hands. I'm looking at his hands, making sure the PIP and DIP look normal, making sure there's no arthritis, no nodules. I'm just going to feel your fingers. Let me know if anything hurts. Just making sure there's no fractures, any lumps or bumps. Want to rule out arthritis. Gonna just rub down your fingers. Very good. And then I'll have you flip over. And same thing, just looking for any lumps, anything that could indicate rheumatoid arthritis. Very good. Any Hebern's nodes. Okay, so the first thing, since you have your hands in this position, what I'm gonna do is I'm actually gonna have you here and try to basically resist me pulling, okay? So kind of push back towards you. And for this, I'm assessing for Dupuytren's contracture, so very good. He has strength in both arms, so that's looks normal. And then what I'm gonna have you do, I'm just gonna assess his range of motion, so I'm gonna have you kind of raise your hands up like this. I'm gonna get up here, and then what I'm gonna have you do is I'm gonna have you kind of twist. I'm just gonna assess your range of motion. And actually, sorry, I'll have you kind of hold your hands up now like that. Okay, so go ahead and do that. The range of motion again. His range of motion is good, very good. You can go ahead and relax. That feel okay for you doing that? Perfect. So next thing I'm gonna do is I'm gonna have him do a Fallon's test. So I'm gonna don't do it quite yet. Actually, you can go ahead and do it because I have to do it for a whole minute. So what I'm gonna have you do is hold your hands like this and squeeze as hard as you can. And we'll do that for a whole minute. So while he is doing that, what we're assessing is the median nerve being compressed. So a positive sign of carpal tunnel syndrome, which we're assessing today, is him having that, kind of recreating that pain that he usually experiences. So It should be positive if he does have carpal tunnel. Oops, what did? So continue doing that for a minute. And then if we wanted to do a reverse phalanx, instead of him, if that was like too hard to do, like just holding hands, we could have had him hold it like this. That would be a reverse phalanx test. And then we're just gonna go ahead and say that that's been a minute just for time-wise. So you can go ahead and relax. How did that feel? Did you have any numbness, pain, tingling?
A little bit of tightness in the wrist.
Okay, so you did have some of that. And then the next test is I'm gonna go ahead and have you put your hands like this. So the next test is the Tennille's test. So you're basically tapping on the carpal tunnel ligament for a minute and kind of trying to also, same test, recreate that symptoms of that numbness and tingling. So I'm just gonna raise it up just so that way they can see kind of for the camera what I'm doing. So I'm kind of tapping, and then let me know if you do start having numbness and tingling, and then I can kind of go ahead and pause, see if that's hurting. Yep. Okay. So, and then just let me know, same thing, if it starts hurting, okay? And I can go ahead and stop whenever.
Okay.
Okay. So he did start having pain with those after like less than a minute. So the next test what we're doing is the Durkin's test. So it's similar to those, but I hold pressure on that median nerve and basically causes pain also. So I'm gonna go ahead and hold for a minute. Kind of compressing. And while we're doing this, I could also kind of talk about how his hands looked okay. We are kind of concentrating on the hands, but his elbows, his shoulders, his range of motion, I'm kind of assessing that too, making sure there's no pain when he's moving his hands. That's kind of going anywhere else. That looked okay. I'm assessing kind of also lost my train of thought. Capillary refill, making sure it comes back in 3 seconds when I was assessing his hands. I'm gonna hold it and stop that side. Do you have pain with that?
A little bit, yeah.
Kind of, do you have kind of tingling on your arms, or what do you have?
Yeah, it's kind of in the wrist there, kind of going to the fingers.
Okay, then I'll go ahead and do this other side for the Durkin's test. And then also, while I'm doing this, I could have assessed also his radial pulse, making sure good blood flow, no irregular heartbeat or rate or rhythm is going on. So that for him was good. And another thing that we could do to rule out like a fracture or arthritis is do an x-ray, which we won't do since we're kind of by all the symptoms it might be carpal tunnel. So I'm going to go ahead and stop that. Did you have pain on that side?
About the same.
Okay. And then also another thing I'm going to say, like here, I'll show you. When I was assessing his hands, I was assessing that tender muscle, and I'm going to go ahead and feel that, just making sure there's no issues with it, no atrophy. So that's good. Pressing down. And then I'm also going to just assess his strength as well, his range of motion. So I'm going to have you kind of hold your hands out like this towards me, kind of in like an okay. And I'm just going to pull and make sure he has strength. So yep, good strength. And then I'm going to have you squeeze my fingers, just kind of squeeze, and I just want to assess your strength. Very good. And then I'll have you do the other side. Very good. So perfect. So from what I assessed of you, it does seem like carpal tunnel, but I'm going to just also assess your sensation real quick, just to make sure you can feel like your hands, that you don't have anything else going on. So I'm going to have you close your eyes, and I'm going to have you lift your hands out, and you can kind of rest it against the pillow. It's fine if that's okay for you. And just let me know if when you feel my finger touching, okay?
Okay. Okay. Yep. 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 Okay. 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 Okay.
Perfect. You can go ahead and open your eyes.
Yep.
So sensation is good. So we're good there at least. So what I'm going to do is I would refer you over to get an EMG. That's a nerve conduction study. It tests for carpal tunnel syndrome. Sometimes those tests are not fully accurate. Like sometimes I've had where they do come back negative, even though patients do have carpal tunnel. So I'm gonna prescribe you some Mobic as well for your carpal tunnel, and computer keeps on shutting down. Mobic, to your pharmacy, 15 milligrams. Take that once a day, and then we're gonna try that out for 3 months and have you come back in 3 months and assess if that Mobic, it's an anti-inflammatory, to see if it helped you. With this anti-inflammatory, don't take any other anti-inflammatories just because we don't want to cause your stomach like any GI bleeding, any stomach pain. You can take the Mobic with food. You can take Tylenol too, that's fine, just don't take like ibuprofen, anything like that. And then also, sorry, you can use heat as well for the, sorry, heat as well for the pain as well. Just use that throughout the day for like 20-30 minutes. Just don't put it directly on your skin, like put like a barrier cloth over it. And then also you can kind of do exercises with like either Play-Doh or just range of motion exercises, kind of do some stretching for your hands. And then for nighttime, since usually carpal tunnel is aggravated at night, you can do some splinting. It's kind of like a brace you put on at night that you wear. So it kind of helps keep your hands stabilized in one position. And then just give us a call if you have any other problems as well, like come up sooner. And then do you have any questions for me?
I'm aware of at the moment.
Okay, well, Gary, it was nice meeting you, and thank you for letting me assess you.
No problem.